we were a research active organisation. So it's not that it started something for us, but what it did was enhance what we've been able to do. We've been incredibly lucky to have as much support as we have from the NIHR. But that's also come with a lot of hard work. But I think if without it, we wouldn't be able to do as much research, definitely. We certainly wouldn't have as many people working in R&I because that's paid for by the NIHR, and that gives us the basis to be able to do more. So they have changed the landscape of research across the whole country, not just at NUH, but it has allowed us to become one of the most research active trusts in the country. I think by having an organisation dedicated to research as part of the Department of Health and Social Care, it has really brought forward the idea and concept of research. I think a lot of people think of research as being something that people in white coats in labs do. And actually clinical research is incredibly important for advancing the work that we do in the NHS. And having a research arm of the NHS is incredibly important. It showcases that it is something we do in the NHS. But I think if you think about it nationally, before the NIHR, there were probably about 30–40% of NHS trusts involved in research. Now 100% are. That's the difference they've made. So I think the BRC in particular is around translational medicine and that real crossover from working in a lab, but then bringing it to the bedside of a patient. So advancing treatments really quickly, or trying to understand how diseases affect people. So bringing that information to clinical care means we treat people differently, so we can give them better therapies that are more personalised to them. But I think it's that collaboration between our academic colleagues at the University of Nottingham and our clinical colleagues here, and having the infrastructure, so the ability to have time and money to develop research between us. And without the BRC, we wouldn't be able to do it on the scale that we do it now. We did it before, but this allows us that space and time to actually really make a difference to care. I think within the Clinical Research Facility Award, we wouldn't have the facilities that we do. We're incredibly lucky. We have one of the biggest clinical research facilities in the country, and it allows us to do really early phase, complex studies, and allows us to have studies where we can have patients staying overnight and really give the opportunities to take part in studies that previously we just couldn't do in the East Midlands because we didn't have a facility like this. And I think it's about being specialised as well and really looking at what we can offer. So the NIHR has allowed us to do that. And now we've got the National Rehabilitation Centre, and alongside that we've got the NIHR Health Tech Rehab Centre. And that's going to transform care nationally for people. And, we wouldn't be able to do that and work with companies in Nottinghamshire who are developing new ideas and ways of treating people using technology. And we've got that ability to do that now. So it's incredibly important to be part of those awards. A lot of people wouldn't recognise some of what the NIHR Academy does. And I think if you think about what we're trying to do at Nottingham in terms of our Research Futures programme, it's very much around looking at those opportunities. So we have the Early Career Researcher Awards, so people who are probably doing research but perhaps not for themselves, and it gives them the opportunity to get awards where they can actually develop their own studies and go on to get PhDs, really develop their career opportunities, but also giving them a basis to become experts, and then going on to get things like Senior Investigator Awards, which allow you to showcase your research, but also allows you to develop projects locally and develop our senior investigators. We have to remember that everybody needs development, whatever career stage they're in, and the NIHR allows us to do that. But it brings people the opportunity, and quite often, I think research has been the domain of medical staff, and because of the NIHR, we've actually been able to expand that in a much bigger way now and include our nursing and midwifery colleagues, our healthcare scientists and our allied health professional colleagues. And it's really opened doors for people to have research careers that perhaps wouldn't have done 20 years ago. I think I'm incredibly proud of the fact that we have got these research infrastructure awards like the BRC and the CRF, and we continue to be awarded those, and that's really incredibly important. You know, I would hate to lose that ability to deliver the care that we do because of those research awards, but also the amount of grants that we've seen that we've been incredibly successful with, particularly around the research for patient benefit, and that is particularly one of our favourites here at NUH, and we are quite successful, but it's a really important one because it does have a direct impact on patient care, hence the name. But you know, we want to be able to support people to improve care as quickly as possible. Research can take a long time to come to fruition, but because of the amount of awards that we get through the NIHR, we are able to advance care quicker. So I'm incredibly proud of our team getting through those grants with our clinical colleagues. So I started with the NIHR in the Comprehensive Local Research Network in 2009 and worked with them until 2021 when I came to NUH. And I had a variety of different roles, and it really grounded my experience as a manager in NHS research and giving me a lot of opportunities to develop myself. And I don't think I'd be in the role that I am now if I hadn't had that experience with the NIHR. And it's really important to understand the national landscape, and I think that helps me do the role that I have here at NUH. I understand how the NIHR works and how we can really give people opportunity, particularly around career development, as we've just talked about. But that's really important for us in research and innovation, that we are advancing care, but we're also advancing our staff. And the NIHR definitely did that for me. So I think it's a really exciting time for us here in NUH. We are in the starting the process of rebidding for our biomedical research centre and for our clinical research facility in the next 18 months. And you know, I'm really excited about the opportunities that will bring us. We are also looking at, there's a new programme for research delivery leadership. It's a brand new award, and we intend to put in a bid for that and be one of the leading centres around research delivery in the UK. We're working with our colleagues in primary care, particularly Simon Royal at the Cripps Health Centre, who has just been awarded a commercial research delivery centre, and we're a partner in that. And really want that opportunity to work across the whole region to deliver research and really showcase what Nottinghamshire can do in partnership with our colleagues in our other NHS trusts and primary care. Yeah, I'd like to take this opportunity to say thank you to the NIHR on their birthday because of the opportunities that they've afforded the NHS, particularly here at NUH. A lot of what we do, we wouldn't be able to do without the NIHR. So there is definitely a big thank you there. But also a thank you to our team who work incredibly hard to maintain that NIHR partnership, whether that be people who are managing the awards that we receive or the people who are delivering the trials that make those awards happen. So thank you. We work incredibly hard, and I'm incredibly proud to be part of the NIHR family.